Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Etomidate. Etomidate. Benzodiazepines. Benzodiazepines can be used as pre-medication. In benzodiazepines as pre-medication, midazolam is most preferred. Benzodiazepines are anxiolytics. They can cause anterograde amnesia. They are antiemetics. So midazolam is an antiemetic also. Midazolam. Midazolam is a benzodiazepine which is most commonly used. Short half-life of midazolam is 2 to 3 hours and it can be used in daycare surgery. The midazolam has short half-life. Half-life for midazolam is 2 to 3 hours, whereas half-life for benzodiazepines is 36 hours. Half-life for lorazepam is 15 hours. Water-based preparation. So midazolam is painless. Injection of midazolam is painless. So it can be given as intravenously or intramuscularly or orally as intranasal spray. Remimazolone. Remimazolone is also a benzodiazepine which is still in phase 3 trials. It is an ultra short acting which acts for only 30 to 40 minutes, but it is still in phase 3 trials. Summary. Benzodiazepines are used as pre-medications, and among them midazolam is most preferred. Benzodiazepines are anxiolytic, amnesia, and they are antiemetic also. Midazolam is the most common and it has shorter half-life of around 2 to 3 hours, which is used in daycare surgery, which is painless, so it can be given as intravenous, intramuscular, oral or intranasal agent. The diazepam half-life is around 36 hours and lorazepam half-life is around 15 hours. Ramimazolam is one more benzodiazepine which is under phase 2 trials and it is ultra short acting with half-life of 30 to 40 minutes.
thank you and thank you for watching.